Our team, welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. We had a little line change here, if you will, for those of you who play hockey. Boom, boom, boom. Switched it out. So we got our lovely ladies of Austin Plastic Surgeon join us today. Not all of them, but some of them. Some of our key members, if you will. But before we get to the good stuff and we talk a little bit about Hyperdilute Radiesse, which is a interesting hot topic for sure in the injectable world. Let's catch up. Let's see. We haven't done a podcast in a long time. Maybe ladies first. Christine, what's going on in your world? What's going on?
So I am turning 40 next weekend.
Ooh, what are you doing for the big fours here? Can we talk about this one?
We can. I'm having a party on the river, going tubing and running a boat for Sunday. And I got plans on the water. Hopefully it doesn't rain on Memorial Day weekend, but yeah.
I feel like you and I need to check our mail because I haven't by, but it must be in there. I'll check my mail as soon as I get home. Boom, boom, boom. Excited. Use your sunscreen. Be safe.
Yes, of course.
Happy early birthday.
Thank you.
You don't look anywhere near 40.
I appreciate it. I just had a really good peel last week. I think it peeled all my wrinkles away. So yeah, thanks, guys.
Well, next session we'll have to hear about this.
Yeah. I'll let you know.
Boom, boom, boom. Sarah, what's going on with you?
So I recently went to Florida to see my family. Mom, dad, and brother are there, and my brother had a newborn baby, so I am now an aunt. Miss Riley Ray is her name.
Congratulations.
Girl. Thank you.
Sounded like you kicked off bikini season already.
Yeah, I have. You've seen a couple posts.
Yeah.
I've been repping the Austin Plastic Surgeon bikini.
We did get our new bikinis in, so that's exciting. More to come. But
my Speedo hadn't come in the mail yet.
We need to get to that.
We're saving that little thing for the end of the episode. But and anything new in the injectable world for you?
I know we have a couple meetings coming up with some new products potentially to look at, so I'm excited about that. I think there's a longer lasting neurotoxin we've all been chatting about and anxiously awaiting, and maybe some more stuff for cellulite.
Yeah, some exciting stuff coming up. And then you were in San Diego as well.
I was. Absolutely loved it. It was great. Learned a bunch of new tips and tricks for med spa, growing the med spa, retaining customers, all that fun stuff to bring our patients the best experience. So super exciting.
Okay, awesome. G, what's going on with you?
You alluded to it a couple episodes ago, but we're getting ready to open up our second location. So I've been helping get that up and ready in terms of getting the space ready and getting it all set up with furniture. And there's a little construction going on with the space. So, trying to help move things along, and just really excited about that.
Yeah, there was just some fun little tweaks we were trying to do to make the office super efficient. So we're home stretch. I mean, we're literally like countdown days away. So we're so close.
Yeah.
So close.
Super excited.
But not quite there yet.
Yeah.
T-Bone, what about you?
So it's officially boat season in Austin. Gotten to go out and wake surf a couple times with a couple of our buddies. And then we went.
Our invite for the boat must have been next.
It must have been.
That's lost in the mail.
That mail carrier. We got we got to get on that.
We need buddies with boats.
I know. Interesting. Thank you,
so
T-Bone.
We actually just went up to Dallas 2 weekends ago and saw a concert with some friends, hung out. It was nice to kind of unplug for a long weekend. So that was nice.
Okay. Awesome. Well, let's jump into it. Let's have a little fun here. Let's talk about it. G, this was your topic. Take it away. What's going on?
So I thought it would be interesting to discuss hyperdilute radiesse. I think most of our audience, or at least I would like to think most of our audience, may be familiar with radiesse as it stands. But for those that aren't, radiesse is a type of filler that we have in our practice, and it's a little different than some of the other fillers that we typically use in that this one is a calcium-based filler. It's called calcium hydroxyapatite. And so it works a little bit differently. The technology is a little bit different. But in its pure form, it functions very similar to that as our HA fillers. But today we're talking about hyperdilute radiesse, which is basically taking the radiesse product and blending it down with either some bacteriostatic saline or lidocaine for patient comfort, and using it in its biostimulatory effect, meaning that it stimulates the body to produce more collagen, and in that sense helps with an array of different things, but can help with skin tightening, can help with the appearance of the skin, giving it a little bit more of a natural glow, but also has filling effects like the radiesse would in its pure form.
It's interesting. I mean, this is such an exciting topic that you choked Nurse Sarah Mack up. So hopefully she's coming back. But I think she just got so excited about this topic that she choked on her own excitement. So we hope that she's okay. Please send your cards and well wishes to her. But you actually, they can't send it to you because you actually have a new Instagram. Is this correct? What's going on with this? Did I see this? Is this like a new Bumble or new Tinder? What's going on?
No, my new Instagram, I just did an injector page.
Oh, okay. Can you catch me up on this? I didn't even know. I found out from the gram. Boom.
Yes. So I started just storing all of my amazing before and afters on there so that I could keep track of it.
But are you going to tell the people what it is, or do we have to keep guessing?
The Injector Austin is the name that I chose, which was surprisingly available. So that's my new IG handle.
Okay.
Awesome.
Boom, boom, boom. Well, we're excited about that. Yeah, tell us a little bit more. So Hyperdilute, this is super cool. And I feel like this is kind of our past episodes have alluded a little bit to this. It's Radiesse in of itself is not a new product, but kind of expanding our use, our kind of understanding of the capability of the products is what is relatively new here.
Yeah. So just to kind of take it back a little bit, Radiesse in its pure form has been around for quite a while. I remember using it in my practice back in like 2006, 7, around there.
My gosh, what were you, 9 years old practicing with them?
But before podcasts were even a thing.
Yeah, before podcasts were even a
That's
thing.
interesting. Wow.
And back then we used to use it to do just regular dermal filling like we do with HA fillers. So essentially nasolabial folds or smile lines, marionette lines, which are the lines that run from the corner of the mouth down to the chin. And that's where we were pretty much placing it at that time. As we know, things have kind of evolved and changed, and the placement of this product has kind of moved around a little bit on the face, from cheeks to jawline, backs of the hands, things of that nature. But Hyperdilute Radiesse is a little bit more of a newer concept. And so essentially what we're doing is we're, like I mentioned, blending down the product and using it in areas where maybe the skin might be a little bit thinner or a little bit crepier, and we're trying to give it a little bit more definition, a little bit more structure, trying to, for lack of a better word, thicken the tissue to improve the appearance of it. So, some of the areas that we're using this Hyperdilute Radiesse is in the neck, as well as the chest, or what we commonly call the décolleté area, for some of those fine lines and wrinkles. It's also being used quite a bit in elbows and knees for skin that kind of thins out a little bit in those areas. It's kind of hard to treat with other treatment modalities. I find that this is a really, really great option for those areas, especially because they're areas of motion.
Let's back up a little bit before we go, because I want to go into each of these. You covered a ton of topics there, and let's dive into each of those a little bit more. But just so people who know, because Radiesse has actually expanded a little bit, because I think you alluded to it, was most commonly used in the cheeks previously. Actually, just recently, and it actually got its indication last summer, but really kind of launched, from a marketing standpoint, an indication for jawline, which has almost been one of my favorite areas for Radiesse. And I think some of the things that make it unique is it is a calcium, which is different than some of the HA fillers. Yeah, right. That maybe we can get Sarah to comment in once she comes back from her break of you choking her up. And so. And I see what Gilbert did here, right? Put a little something in her coffee. Sarah's out.
I'm going to dominate this episode.
Like,
this is all
This is
mine.
Episode G, G talking about the calcium, And so
it's really the effect that I have on women.
Oh. So many things I want to say, but I want us to be able to stay on the air. But I think it is a little bit thicker, a little bit stronger, which is some of the reason that it's an interesting product to use to restructure some of that bone, to be able to lift some of that. And I think, and you had talked about spending some time with Shino Bay out and talking about these biostimulatory. And I think this is definitely a new wave of aesthetics, and we'll jump into Christine here in a second, but I think trying to do some regenerative medicine, people love this, especially in Austin, where we want to be natural, we want to do some of these things. Is how do we improve our most of us want to age gracefully. We don't want to look like somebody else. We don't want to look overly fake, but if you eat right, you take care of yourself, you do want to get into a good spot with something.
Yeah, maintaining your natural appearance, but like you said, doing it at your own pace.
Let's jump into, because one of the areas that I love this and I think it's so exciting for is the décolletage, if you will, the neck area. Maybe you and Christine can kind of talk about how do you know what's a good spot for it? Because some of it is laser, which we're going to get into in another spot. Some of it's maybe skin treatments, whether we're talking about RF microneedling. Maybe it's talking about being on a good moisturizer. But at some point, there's only so much topical stuff you can do, and then you transition over to filling and kind of softening these, because I think this is a hidden area that we all look at the face, other stuff, but this décolletage is the giveaway. Décolletage and hands are the two giveaways of people's real age.
Yeah, because you can certainly have someone who's been lifted and had a facelift and a neck lift, and they don't look their age, but their neck and décolleté area can age them. If you have a discerning eye, you can take a look and
you see that patient with a perfect facelift and they look like they're 38 years old, and then you see their neck and they're like, wait a second, are you 60 something? Or
exactly.
Or they go to shake your hand, and that looks really aged. And so maybe can we start with maybe the least invasive, and then just see that way we know like who would be a good candidate for the hybrid, because I think that's sometimes hard for a patient. So when somebody comes in with concerns of neck, décolleté area, how would you start like the most mild? Like what are some treatments, and then when do you refer them to Nurse Sarah or Gilbert for maybe some hyperdilute treatment, and then we can get into the treatment itself.
Yeah.
Oh,
I think, like y'all were saying, the neck and décolleté and the hands are the most neglected area.
Don't judge me for not saying that, Rob, but I'm doing my best.
Décolletage.
I'm trying to sound fancy.
I think people forget to put sunscreen there. They forget to bring their products down in that area. So a lot of people, like you guys were saying, age on the chest and the hands, and their face stays youthful. So something I like to ask my patients, what bothers you when they come in for the consult, so I can kind of get on their page about, is it spots, is it wrinkles, is it laxity? So since we've had the Morphus in the office, that seems to be, the
For
heavy.
those that don't know what Morpheus is.
Radio frequency with microneedling.
Okay.
So super effective for all of these issues: skin laxity, texture, tone, and then we also have Lumecca for the spots. So I love doing combo treatments for that. I think, looking at the patient's age, like you said, skin laxity, crepiness, if it's we can do 3 treatments with Morpheus to try to help with that. But if there's just so much laxity that they need volume, Morpheus, it's not going to give you volume. So maybe a couple of treatments of Morpheus and then attack it with some filler. That's kind of new to me, the filler and the décolleté. I think this past week was the first time I had kind of heard of that treatment. So
it's an underutilized treatment, and I know we've talked about it, and I think sometimes we get so fixated on the face and other stuff, we forget about this other area. So help me understand a little bit, because Gilbert and Sarah, you guys maybe jump in here and help me, but because if somebody I think they should be on a good moisturizer no matter what. I think they should be on a good sunscreen no matter what. We agree there?
Yes, absolutely.
Unanimous? Okay. And so once we get past that, then it's deciding whether it's the spots or whether it's the kind of texture. So tell me, the hyperdilute is going to treat specifically what? Some of the skin laxity? Yes or no?
It might help a little bit in the sense that it's going to stimulate collagen, and that collagen is going to help support the tissue. Okay. I can't tell you that it's going to lift the skin. It's not going to like give you like a lifting effect, so to speak, but it will help with the appearance of the skin laxity to some degree.
Because it also fills some of that skin. So it is going to help with the appearance, right? Because some of those wrinkles, some of the crepiness is going to get stretched a little bit, right?
Right. And as like I mentioned earlier, so it's blended in or blended down with either a bacteriostatic saline or some lidocaine. So you're going to have a little bit of expansion from all that fluid. But as the fluid gets absorbed by the body, then the calcium hydroxyapatite, the Radiesse product itself, starts to do its work. And so it starts stimulating that collagen production, which in turn, over time, is going to give you more of that long-lasting smoothness to the décolletage area, to the neck area, but it is kind of like this. You get benefits in the short term and the long term because of that, because of the way it works.
What would you say is like a time frame that patients can expect, for that neck and chest and upper chest area?
So, the recommendation.
Notice I had to say upper chest, décolletage.
Yeah. You did, yeah.
Interchangeable. So
okay, perfect.
So currently, the recommendation that I have for my patients is doing these treatments in series. So usually doing a series of like 2 to 3 treatments separated by about 4 to 6 weeks apart from each other. And then after that, you can expect to have these results last anywhere from 15 to 24-ish months. It can last up to 2 years in the right conditions if you take care of your skin, you use the sunscreen, things like that, right? But as far as like seeing the results in the short term, like I said, I think you're going to see some benefit in almost the immediate short term because of that expansion of the tissue from all the fluid that is used in this blended product. So
Sarah, would you say that this is almost like an area that needs like a two-pronged approach? Because it sounds like you're treating both sides of the skin. Is that fair to say?
Yeah, that's actually exactly the point I was going to make. You read my mind. I think it's super important. I'm glad we have Christine now in the office because her and I pass a lot of people back and forth, right? It's not necessarily filler and toxin only. We have to take care of the skin too. So I think some sort of resurfacing, peeling, things like that in combination with the Dilute Radiesse is a great combination too. We have to take care of the skin and then give it some support and volume back.
Yeah. And we have specific products for the neck and décolleté, and even for the hands. I mean, some filler on the hands with some Lumecca to get rid of the sunspots, and then, a good hydrating, moisturizing sunscreen for the hands really changes. I mean, you can tell night and day. Just doing that, over the course of a couple weeks will change the way someone's hands look. So,
I think it's really important to educate the patients, because I think in the world of aesthetics, a lot of people know neurotoxin and filler. They don't know what else is out there. And so when you refer them, to both of us, and she can do the skincare side, I can do the filler and toxin side, and then we can send you home with some maintenance products, people's results are so much better over the long term. Wouldn't you agree?
Yeah.
Yeah.
And this is what the benefit of having such a diverse team and trying to add members that have different specialties is, I feel like if a hammer's all you have, that's all people get. And I feel like, the nice thing about having so many different people, so many different, we'll call them toys, you guys can call them medical devices in the office, is that we can really give people what they need and not just what we have. And so I think that's super exciting. Do Sarah or Gilbert, do you want to walk us through what the actual process is if somebody comes in for like a hyperdilute treatment of this area, and then we'll kind of walk through some of the other areas because there's you touched on a bunch, and there's a few more that are a little interesting too that I hope we'll get to.
Yeah, I had some others in mind, but you cut me off.
Yeah, well, I don't want to give people everything at once because then they'll turn us off because they're like, I've already heard everything, and then what do we do for the next 30 minutes?
Okay, that's fair.
Which one of you wants to talk a little bit about what the actual treatment would be like?
Yeah, so for the neck and décolleté, we actually there's multiple ways to do lots of fillers, right? You can do them just, primarily in the neck area with cannula is what I've been taught. I'm guessing you feel the same way. So we'll do little pilot holes, usually 3 on each side of the neck, and then we just go in with a cannula after we've diluted down the radiesse, and we fan that area in, massage it for a few minutes afterwards, and that's it. It's pretty painless, pretty seamless. There's just a little bit of pressure noted as we move around with the cannula, but people tend to tolerate it really, really well.
But so for the most part, it would be similar to any other injectable that they would come in, get some numbing cream, probably in the office at most for an hour or so, unless they're doing other treatments at the same time. Maybe some bruising that you would expect because it sounds like you are covering an area that most likely, especially with 100 degrees, would be unlikely to be covered with clothes.
Yes, definitely bruising. Those patients that are specifically worried about it, some people just bruise worse than others. We can start them on like arnica tablets a few days before their procedure. We have them avoid any NSAIDs, ibuprofen, fish oil, things like that, alcohol before the procedure. And then we also recommend arnica gel topically afterwards.
And then just for people's planning before we jump into the other areas, it sounds like there's some immediate benefit, but if you're really trying to look good, in this area for something long term, this is maybe something that you'll need multiple treatments and really need to look at as a long-term treatment that's going to help you over the long term, right? So you get some quick and some long.
Correct. And that was one of the points I wanted to allude to. Is that there is that short term, almost instant gratification from the actual filling effect, right? Yeah. But then there's also that long term, slower onset, delayed onset kind of benefit from all that collagen production. So if you're looking at the long term and trying to figure out, well, how long is it going to take for me to get to the final product? You probably want to plan these sessions about a month apart from each other. And like I said, I recommend about 2 to 3 treatments in series. And so you're looking at a process, right? But if you're let's say planning for an event that's coming up in a matter of a few weeks, you're still going to have some of that, nice smoothing effect from the immediate impact that the filler has on the tissue. So, it's again, the short term and the long term that you got to look at.
One last question before we jump into the other areas. If I'm trying to decide on like the order of treatments, I think we can all agree moisturizer and sunscreen should be number one. Should get started. There's no reason not to start that today.
Right.
Agree?
Agree.
Yeah. And then, but after that, I guess, is this where you guys would help guide me as what I do first, and filler, the Hyperdilute Radiesse versus like the Lumecca laser versus Morpheus with the RF microneedling? How do I decide which is the best course of action? Is this person dependent? Is there a set order no matter what? How do I know?
I think it's person dependent. I don't know if you guys want to jump in on that or not.
I think it's person dependent for sure. Speaking of the neck, like a lot of people, if we have our older clients with thinner skin, they just want full on rejuvenation. I've had a couple girls I've treated recently that are in their mid 30s that just kind of are starting to notice these necklace lines, and they want to only get rid of those. So I think it's totally tailored per patient.
Yeah.
And I guess depends on what bothers them the most is where you would start.
That's what I was going to say. I always ask them what bothers them, because what I see may not bother them at all. So it may not be the spots, or it may only be the spots and not the lines. So I think that's important, finding out what they want to fix. Their timeline is super important, right?
Good. We'll fix it all.
So one thing I always tell my patients, or the analogy I like to use, is like, look, you're the pilot, I'm the navigator. You ultimately decide what we do. I'm just going to guide you along the way. And so I can make these recommendations, these suggestions as far as what we should do, but ultimately it's your decision as to what you want to do and in what order.
I don't want to let T-Bone be the pilot.
You are the facial rejuvenation Sherpa. Basically what you are, man.
He just keeps trucking and trucking.
I do all the heavy lifting.
Throw all the stuff on your back and you just start climbing.
Well, I know I cut you off earlier because I wanted to dive into this because I think it's just such a underutilized treatment area that's such a telltale sign. But now that I feel like have a good foothold of that, what are some other areas that this Hyperdilute Radiesse is used very commonly from either of you? Maybe one each.
I like the hands. I think we've seen really, really good results there. And that's a place that's totally neglected. I feel like when they come to the med spa, they're talking face. And then you see these little sweet ladies with their little wrinkly hands. And we can do quite a bit with one syringe per side. I feel like they get a really good result without needing like 10 treatments.
And this is one of the things I do like about Radiesse is you get a little bit more product for the thing. And I know it's only an extra half cc, but when you think of most syringes are a cc, you're getting, actually, a lot more product. And so it goes a little bit further. So I think that's kind of a nice little nugget. But I definitely feel hands are underutilized and definitely a telltale sign of people's age, especially most of us our age or older. We grew up. We got our first good sunburns. We did this. We didn't do full body sunscreen and things back in the day. I mean, I did it. I got my first sunburn and that was it.
No, all of my patients, like my age and older, we all talk and laugh about like the betadine with baby oil. And
why didn't go that far?
We did. And reflective light, right? To try and get as dark as you possibly can. Who needed the sunscreen? And now we're all paying for it.
Right.
Gilbert, any more nuggets about the hands before we jump into some other ones? I like this. One person picks an area, the other person tells us how we treat it. I like this.
So you want me to explain the treatment?
Oh, sure. It seems like a great plan. Okay. Thank you, Gilbert.
Right. So hands, I don't necessarily dilute or blend down the Radiesse. I think just pure product is perfectly acceptable for the hands. So that's going to be more of a traditional like injectable treatment that most patients are familiar with. And in all honesty, the procedure for the patient from their perspective doesn't really change much at all. It's all on the back end where we're actually doing the chemistry behind it all and blending down the product with either of these diluents like lidocaine or the bacteriostatic saline. But to the patient, it's all going to be the same. In terms of the actual treatment, there's a couple of points in the hand that are, I guess, preferred. Trying to avoid, obviously, any like blood vessels, but trying to get in between like the joint spaces. And then using either like a cannula, like Sarah mentioned, or just a long needle, making a little insertion point, and then just kind of getting under the skin, but over the fascia. And as long as you're in that plane, you're pretty good as far as avoiding any blood vessels and minimizing your risk for bruising, because that is one of the things that can happen when you're using filler in the hands. If you hit a vessel, it's going to bruise pretty good. It'll go away, but it's going to take a couple weeks, a week and a half, week.
This is one of the things I love about the art of medicine, is it sounds like Sarah likes to do some of the hyperdilute for the hands. Sounds like you don't like to dilute it at all. I actually like to be somewhere in the middle, and I wouldn't say and we're using some of these terms, so there's like dilute, hyperdilute, and that just depends. And some of what that does is it changes the viscosity, how we move stuff, and I'm in the middle. I do like to soften it up a little bit because I feel like I can smooth it out, but it's super interesting that here's 3 different ways to do it by 3 different providers, and everybody gets a great result. And it sort of goes in the context of how we're doing this. So I think that's what's super, super cool about this, and why it's nice because I learn different things, because we obviously don't necessarily treat patients together all the time. Occasionally we have mutual patients and we get to do some fun stuff together, but not as often as I think we would all love. Yeah. And then even on top of that, I think hands are still another area where you can treat some sunspots, you can treat some other little veins, some other things that are more of a superficial treatment.
Absolutely. The Lumecca is great for the sunspots. It also stimulates a little bit of collagen every time you do it. So anti-aging for that. You're going to have some coffee grounds, a little speckling happen for a week or 2, but those just flake right off. And I love that combination, the filler with the Lumecca. And I think you could do them maybe a few weeks apart. I don't think they would.
I think 2 weeks apart is acceptable.
Yeah. And we're talking about Radiesse for the hands, but there's also some other products that you can use in the hands. And we won't. Do you guys each want to name one other that you like in the hands? If there is, if not, we'll keep moving.
Like HA fillers?
Anything you like.
Yeah.
What do you like? What else besides Radiesse? Or is that the only one you like?
No.
Okay.
Galderma Lift does really good for the hands. Okay. And it's indicated for that area too. So that's another really great product.
Sarah, any other?
I agree with him. Lift.
Okay. Voluma, is that one okay?
I've never done it in the hands, I'll be honest. It could be used. Yeah, no reason why I couldn't.
And I've used some Voluma stuff, and I've done the same where I've diluted it out a little bit just so it's not so thick, and that way a little bit of smooth. But there's a lot, and there's some other newer product stuff, and so again, it can be tailored to each person. Some of it just depends on the provider specific, and there's pros and cons like we've talked about for each of these. So I think that's super cool. Yeah. Gilbert, what other areas do you like the hyperdilute?
BBL King. Where else?
Yeah,
the booty.
Yeah, we definitely do a treatment called a tweak treatment. And so this is an area where we've put a decent amount of filler. So number one, I want to be super clear with people. Like when we do a tweak treatment, we named it tweak treatment because that's what it is. It's a small tweak. It's not a replacement for a BBL. It's not going to give you the same look as a BBL. I typically like this for people who have some small little dents, some little spots they want to tweak, i.e. the tweak treatment. And then the idea between this hyperdilute is that it gives us some volume, spreads over this area. I like it because people know what they're getting. I also like Sculptra, which was probably the first one that got popularized for using for body filling and stimulating, in the buttock and stuff like that. With Sculptra, I've had people that are absolutely phenomenal responders and people who haven't responded quite as great. And it's almost a little hard when people are spending a significant amount of resources and a little bit of unpredictability. And so I feel like with the Radiesse, the nice thing in the hyperdilute is that that you're at least getting some minimum volume, even if they're not a great responder to the stimulatory properties.
Yeah. Yeah, no, I agree.
Sarah, Gilbert, any thoughts on you guys for the bud, hip dip stuff? I know you guys do that procedure as well. Experience, thoughts about that?
So more recently, some experience with not necessarily full-on tweak treatments like you do in the office, but doing small little pocketed areas where maybe a patient who was treated with our cellulite reducing product Quo didn't have the ultimate result that they were looking for and have still small little indentations. Going back in and kind of filling those indentations out with some of this Hyperdilute Radiesse has been really, really good. So, I think that's worked out really, really well.
I think we're going to do more of that because I
Yeah.
think the idea that you have this dent for 50 years and just because you release a band that it's going to magically come all the way to the surface and be perfectly smooth, just even from a physiological standpoint seems flawed.
Yeah, yeah. But I've had some really great results with that, and so that's really exciting. I'm looking forward to doing some more of that. What are your thoughts
So
on?
can you just because I don't want to, I think this is such a cool thing, and I've seen some of these results that are really good. I mean, do you see a path forward where maybe we start packaging some of this stuff like the Quo and filler, especially these people who have really deep? Because I mean, I think for us, we want people to be super happy, we want to be realistic, but we also want to figure out a clear path forward for them of what it's going to take to get them to that end point.
No doubt. I think that it's something that you can most certainly get amazing results with Quo alone, but it would behoove us to at least discuss with the patient that there may be a possibility that we have to combine it with some Radiesse in the future.
And I think that's one of the things as we've played with Quo and some of the new side treatments is who's a better candidate for releasing bands, who needs some filling, and I think there's a large portion that need both.
Yeah, I agree.
I cut you off. Continue.
Oh no. So still staying on the topic of the butt, but what are your thoughts on these? I see these like liquid BBLs with Radiesse. I understand that it's not going to be anywhere near the same as like actually having a true BBL from the BBL King. But what are your thoughts on it in general? Like, do you feel like there's a place for it? Do you feel like?
I think there is a place for it. I think that you got to be very, very, very clear with patients of what's achievable. Because if you think about it, even with these tweak treatments, and even if we're doing something like, 15, 20 syringes, if you think about that, that's still, 30, 40 cc's of product, right? Depending on how many we're doing. Compared to a BBL, there's 1,000 cc's of product, i.e. your fat. Right. And so, being super clear about what you can get from this, because in the end, we want to help you achieve your goals. We want you to be super happy. And so we want to make sure that we're being super clear about what we're going to be able to achieve with this. And in my experience, I think people who are trying to look for an overall huge volume change tend to be disappointed. I think people that have very discrete stuff that they want to enhance for the buttock tend to do very, very well. And I think you guys see that in your facial fillers, right? Mm-hmm. Someone says, "Oh, I just don't like the way my overall face looks." You guys will push them to be like, "Okay, like I get that. One, you're not as bad as you think you are. You actually look pretty good. But two, like pick one or two things specifically." And that's what I'll say about the butt that really bother you, so we can focus on those, because then it becomes hard.
Yeah. Not to mention the fact that with a true BBL surgery, those results are going to be much more long lasting than any product that you inject into the butt.
Mm-hmm. So, and just a public service announcement here: be very, very careful what you put in your butt, okay? Because I know some of these products can be expensive when you start doing a lot of them, but the expense of getting some illegal substance or some substance that you don't even know in your butt, when you're talking about your health, your life, those type of things, is much more expensive than any BBL product stuff. So, I don't want to go on a tangent. Just be careful. Know what you're getting injected. Know who's injecting.
Know your injector for sure.
Yeah.
A really great patient, just kind of speaking of the cellulite treatment as well as the Radiesse that I found that I've seen a lot of is with doing the Quo, people kind of confuse cellulite with laxity, right? Mm-hmm. So I've had a few little maybe 30 to 40-year-old ladies come in and they just have a few dimples they're worried about, but they're complaining of kind of along the outer side of the butt with some laxity, and they think the Quo can treat that, but really they just need volume. So I think that would be a perfect person for 10 syringes of Radiesse to just treat that laxity on the outside and then use the Quo for the center of the butt.
I like that. Just almost being laxity is always one that worries me a little bit. Mm-hmm. Remember, unfortunately, time keeps marching on.
Yeah.
We're going to make it better, but we're not going to stop the aging process. Mm-hmm. I think there's some things that will help work with you. Mm-hmm. I always tell people, and I'm not casting any stones in my glass house here, but, yo-yo dieting, going up and down doesn't help the situation. So there's things that if you're going to make this investment, make sure that we're doing a good job to take care of that investment for as long as it can last.
Mm-hmm.
Yeah.
Agree.
Yeah.
What other areas? Because I mean, we could talk about butt stuff all day, but in the essence of time, what are some other areas? Because you named a few other ones that I think are super cool and maybe little hidden nuggets for hyperdilute treatments.
I mentioned elbows and knees.
Oh yeah, can we talk about that?
Yeah, I think that's an area that sometimes either gets overlooked or that patients just aren't aware that there are options for them. And I think that as we mature, as we get older, just time and gravity plays its role on our body, and we start to see some skin laxity and sagginess in these areas in particular, and then the fact that they're areas of motion doesn't necessarily help the situation, but we can restore some of that, fullness and some of that, skin turgor by doing treatments with Hyperdilute Radiesse.
I love this because those are areas that surgically I don't really have a lot of great options to offer people. Travis Hunter, you see a lot of plastic surgeons, but that's probably not an area you see very many treatments of, just because crossing joints is something that most of us try to avoid.
Yep. Leave that for the orthopods.
Because the scarring isn't great.
Scarring's not great. We worry about contractures and limiting range of motion. And even with that, I mean, you made it the point, it's the range of motion. So if we take out too much skin or do something, we can have the undue consequence of limiting some of that, which can be hard to recover from.
Yeah.
And they're not areas that we can hide scars all that well for. No.
Right.
They are areas we can treat with Morpheus and Body Firm.
That's what I was going to say.
Let's talk a little bit about that, because I do think there are areas that got to get, again, I know I'm being this home, but the biggest bang for your buck, get on a good moisturizer. And then let's talk about, you're talking about a little RF microneedling possibly?
Yeah, for the skin laxity on the knees and the elbows, that's really big. And then pairing it with Body Firm, which has peptides and skin firming antioxidants and things in it, that using that at home for your maintenance treatment, of course, and then getting some filler after that. I mean, again, combo treatments,
Absolutely.
We're addressing all the issues.
I feel like you get asked that a lot. I've been with you for a while now, and I feel like every time people say, what can I do about this? You get asked about knees all the time.
We do. People ask us about lipo, but I'm like, you already have loose skin, and then if we turn around and try and lipo or do this, you're going to have more loose skin. Honestly, a really hard area even for us to do Renuvion or some of these things that we're trying to put a cannula down the leg and stuff, and I was getting a little nervous about that, because I want to make sure you're coming out better than you went in, and so sometimes when we mess with these areas, it's a slippery slope. So
it's great to just resurface everything.
And realistically, like for the people listening, like how many, because we talked in the butt that you need a few more syringes than you would think. Like realistically, to treat like a single knee, a single elbow, or the neck area, how many syringes of product does a typical person need? I know it varies, but is it a lot of product, a little product? Does a little go a long ways? Where are we at with that?
So as far as I know, what I've discussed with colleagues and stuff, it basically boils down to like one syringe per side, and then it just depends on how much you dilute it or how much you blend it down, like how much extra volume you're using, because certain areas are going to require more volume to dilute the Radiesse than other areas. So for example, and I'm just throwing numbers arbitrarily off the top of my head, but let's say, for your neck and décolleté area, you do, one syringe of Radiesse, but you have to dilute it like, 2 or 3 times. That's going to be, 4.5 to 6 cc's of product. Something like the elbows and the knees, maybe one syringe of Radiesse, but maybe only one diluted just one time. So then you're getting like 3 cc's of product. And so it just depends on the area that you're treating, but most of the documentation research that's out there pretty much states one syringe per extremity, really, and it's just a matter of how much you blend it down.
Any other areas or topics of hyperdilute we're running short on time that you guys would like to talk about, bring up before
I've heard of abdomen. I've heard the abdomen being treated with hyperdilute radiesse. I've never done it, but I've heard of that for people that are really, really like slim, that maybe have some skin laxity, that are like ultra marathoners or something,
I've done some of that. Hyperdilute, Sculptra, even a product called Renuva, which is a processed fat. So I've done it for two things on the belly. One, sometimes right around the belly button, they may not be a tummy tuck candidate, but they got a little bit of that loose skin after pregnancy, or sometimes other things just to see fill that up a little bit. I definitely think this is in that category where you need more product than you think, and one syringe is probably not going to be enough. Also, too, not that this ever happens, but sometimes people have a little bit of unevenness from lipo, and so even if done a little bit just to try and smooth some of that out a little bit, and I think it helps break up, because sometimes it's the skin scars down to the underlying structure, so sometimes trying to free that up, add some buffer to let this kind of redrape nice and smooth has been helpful. So those are the two things in the abdomen where it's been helpful for me.
And everyone's different. Just to kind of piggyback on what I was saying about number of syringes, like just because most people need one doesn't necessarily mean everybody's going to require one.
Correct.
So, I think it's patient dependent.
And sort of like you guys do with facial fillers, right? The more mature you are, probably the little bit more product you're going to need, and depending where you're at with stuff, and you may not get all the way there the first day.
Right. If you pair it with like a Morpheus microneedling with radiofrequency, you may not need as much product, because you're inducing collagen from the surface by creating that controlled trauma and sending in that energy, where maybe that helps kind of tighten up the skin a little bit. And then if you come back and treat with Hyperdilute Radiesse underneath the surface of the skin, it may not require as much. So it's all dependent.
That's a good point.
Sarah, any other Hyperdilute Radiesse or just Radiesse in general comments you might have?
I do think that sometimes BBL patients don't keep as much fat. I know we briefly mentioned like the tweak treatment, but I feel like we do those a lot of times for people that just want more results. But sometimes that fat doesn't take in certain areas just by their own body makeup. You do as best you can during a BBL. Sometimes they have just little spots that they want tweaked that's not worth taking them to surgery. And so I think we've done 2 or 3 syringes in one area just to round something out a little bit more, and they're super happy.
Yeah, I do think it definitely can, and we can play with it. And we, Hyperdilute's one specific, but sometimes we can play with that, depending on where we want to go and do and those type of things.
Makes a great difference.
Christine, tell us about the 2-prong. Let's go to
Well, I just wanted to share my personal experience.
Yeah.
2 things. Sarah recently injected me with Radiesse, and that was my first time getting it in my cheeks and a little in my chin. And it feels different.
Chin is a good one.
Yeah.
Chin is a good one.
Yeah, it makes such a difference in my profile. And then I'm used to having Juvederm products in my face, so this one feels different. It feels like it's staying in place really well. I don't know if this is a thing, but sometimes I feel like tinglies in my cheeks, and I like to think that's the collagen stimulating and waking stuff up, because I'll just be sitting there like tingle feeling. But I also, in the past at a derm I worked with, had my earlobes injected with filler. I don't know if that's a common thing, but I've worn heavy earrings all my life in high school and everything, and I had saw my grandma's earlobes at one point in my life and kind of freaked out because they were very droopy, and I'm like, oh no, is that going to happen? And so I've had filler put in there, and it made a difference. It kind of made it filler, and I could wear my heavy earrings, and they weren't, so just kind of an odd experience that I had that people, like you said, may not think of that area, but
even helping earrings stay in a better place, because sometimes when they get the openings get loose and the skin gets soft, they kind of turn in weird ways, and so kind of like gets it just a little tweaked a little bit.
I actually had one that hung lower than the other, which I probably had all my life, but they evened that out with the filler too. So
and we'll come back to it. And it was funny because offline we had talking about how people know which way to go between jawline filler, chin filler, chin implant, lipo, Renuvion of the next stuff. So maybe for a future episode we'll talk about that, because I do think they're super powerful, but I think sometimes people don't know which treatment is best, and maybe we can help outline that for people. So we'll put that on our list. Future conversation for us for sure. Yeah. Anything else? Summarize Hyperdilute. Anything that you guys would like to talk before we jump into a little behind the Bovie segment?
The only thing I would say is, as far as like, because I don't think we really talked about, any kind of like anesthesia where Travis would normally jump in.
I was trying to minimize this time.
No screen time for this. Glad to be here.
But like any other filler, it's mostly just local, topical, anesthetic. We have Pronox in our office that we offer our patients, but for most patients, I don't think that's necessary with this product.
And Travis, you correct me if I'm wrong, but typically like extremities like arms, knee stuff are going to be less sensitive than like a face or something like that.
Yeah, definitely. And speaking of, I have recent experience. I came in and Nurse Sarah injected me with some Dysport, and it's really not it's not an unpleasant experience at all. You feel a couple little pokes when you're first getting the needle introduced, but it's a very, very small needle gauge. It's a fresh needle, so it's not dull. And you guys use the same types of needles when you're doing these fillers, outside of when you're using a cannula. But everybody here is awesome as far as an injector goes. So you get what you pay for.
Yeah, I think that's a good point too. I change out needles a lot. I'm sure you do. Every couple, areas that we're treating, we'll change the needle often. That makes it a lot more comfortable.
Absolutely.
Mm-hmm.
What's a little behind the bovie nugget that you guys would like to share with our listeners?
I got one.
Yeah, please.
Diluting, or I mean dissolving.
No.
Oh, okay. I have one.
Okay.
Can I say mine first? Yeah. So one point that I think is important to make about Radiesse is that it is not dissolved with Hylenex. So certain areas that we place it, we just like to really inform the patient, like, hey, if this is something you're on the fence about, we just need to talk a little bit more about it. It's not like a regular HA that we can go in and dissolve, a week later if they're not happy with it. So
That's cool.
Yeah. What I was going to say is that on the horizon is a product that actually combines the main ingredient in Radiesse, which is this calcium hydroxyapatite, with HA, and it's going to be a combination filler of both HA and CAHA.
That's going to be exciting.
So that'll be really exciting to see, because you'll be getting, at least in my mind, my theory is you'll be getting the immediate filling effects of the HA with the delayed, stimulatory effect of the collagen induction. Yeah,
that's awesome.
That's cool.
It's amazing how many things are out there and in the horizon.
Yeah.
Should we do a little quote of the day?
Mm-hmm.
Yeah,
Okay.
we know. I actually came up with one the other day.
Quote by you.
Like you created
Quote by me. I actually posted the other day on Instagram. Past couple weeks with work have been crazy and going kind of 1,000 miles an hour, and I realized that I needed to slow things down and go back to a place of controlling what I can control, which is only my mindset and my reaction to things. So,
Sarah, can we fact check this too afterwards to make sure that this is not
solid on Instagram.
you already know what it is.
Three little things. Focus. These are new focus points for me. So solutions over problems, opportunities over setbacks, and gratitude over frustration. Mm-hmm. I think if we're focusing on seeing solutions rather than seeing what the problems are or identifying problems, it's going to put us in a better mindset and make it so that we can approach things with hey, let's make a positive change. Within that's, applicable to patients too. Hey, instead of, I've got this turkey neck going on. I've got this skin I don't like. Okay, well, what are some solutions to that? I think those fillers do a great way of, the dilute filler, that we just talked about and everything. Those are solutions to that issue. Opportunities over setbacks. So, for us, it's seeing setbacks as opportunities to improve things, opportunities to get better in those areas, and then gratitude over frustration. It's easy to get frustrated, but then you've got to realize right now you're being frustrated by something that 10 years ago you were dreaming about. So just having that perspective and seeing that, hey, I'm lucky to be frustrated by the current things that are going on in my life. That is, we just got to be happy about where we're at and where we're going.
Mm-hmm. I feel lucky to have you as my life partner.
Wouldn't have chose anybody else.
I actually went on your Instagram when, Mary tried to claim that, you were her she was your shining light. And I said, no, I'm his shining light. So her and I are non-speaking terms right now. But I think that's an incredible quote for everything going on in the world and the craziness over the last 2 or 3 years. So I think it's easy to get caught in the woe is me freight train for sure. And so, as hard as things have been, I think a lot of people have had some great success. So trying not to forget about those nuggets too.
There's always something to be grateful for.
Absolutely.
G, you want to summarize, take us home, close us out for the day?
Yeah. So in summary, this product has been around for quite a while, but we are finding new ways to utilize it. And I think the horizon, or let me rephrase that. I think the future is bright in terms of aesthetic medicine. And
way to take Travis's quote. Thank you.
Yeah. and I'm really looking forward to seeing what else comes around. I mean, I think there's just so much opportunities, not setbacks, in aesthetic medicine.
We'll close us out.
I'll do that. Thank you all for joining us on Plastic Surgery Untold, the greatest podcast in the world, as voted by us. Stay tuned for our next episode, where we'll be talking a little bit about Lumecca, which you may have heard about a little bit on this episode. We'll dive into it a little bit deeper in the next episode, so stay tuned, and we'll see you then.